My name's Tom Powles. I'm a medical oncologist from Barts Cancer Centre in London. I was going to give a quick update from ESMO 2020 on the maintenance Avelumab program. There have been 3 abstracts, and also the data came out in the New England Journal today on the 18th of September, which is an important step for the drug. It has FDA approval, and I would expect other approvals in the future because over the overall survival hazard ratio of 0.69 is still the lowest we've seen in urothelial cancer. Remember, it's maintenance Avelumab, so after frontline chemotherapy, so those patients who are responding to therapy or have stable disease are then randomized to Avelumab or best supportive care. Overall survival 0.69. Today, or at this meeting, we see a breakdown, a subset analysis of the data for those patients that had a response, complete response, or stable disease. And we saw broad benefits across those groups. We saw the drug benefiting GEM-cis or GEM-carbo population, so previous chemotherapy didn't seem to make any difference. We also showed impressive quality of life data, showing the maintenance Avelumab arm having very similar quality of life to best supportive care. That's quite difficult to achieve because best supportive care is obviously would be associated with pretty good quality of life. I accept that after chemotherapy, many patients are struggling to get back to normal. But nevertheless, I think achieving the same quality of life as best supportive care is impressive. And then the last piece, of course, is the biomarker piece, where we show that the biomarkers are not complete for PD-L1 and TMB. Neither on their own are good enough to identify all the winners. And then we then go on to identify other biomarkers, and gene expression analysis shows that both the innate and adaptive immune systems are relevant. We can show immune active signatures are key to, or look promising in terms of identifying responders. And then finally, we showed in those patients with immune active tumors, we could show that signatures such as angiogenic signatures, Notch signatures, and TGF signatures are holding back those responses. So we're identifying mechanisms of potential resistance for the future. So the Avelumab program is moving on very quickly with exciting new data, supporting, I think, its use, and also getting a better understanding of how the drug's working and in whom it's working. Many thanks for your attention, and I hope you enjoyed the meeting.